Hello and welcome back. My name is Aisha Khan and we're going to continue talking about preparing for an emergency. This is part 2, personal protective equipment and resuscitation rooms. We're going to discuss the same scenario we discussed in our triage lecture. That is, you work in a hospital near a small farming village where the farmers were spraying insecticides when all of a sudden an accident occurred. 2 farmers were injured and their machinery hit the water storage for the farm, causing flooding and runoff to go into the village's drinking water. Remember, when we approach emergency medicine patients, we have to be prepared to evaluate, think, and act quickly. When multiple patients are coming in and we have to act quickly, we can best meet the challenge by being prepared. In the triage video, we learned to create the best situation possible for helping our patients quickly and safely by prioritizing them to see the highest acuity patient first. Now, we will talk about how we can create the best environment in which to help these patients by always using personal protective equipment and by creating a resuscitation room to see the most critical patients. We cannot take care of our patients without taking care of ourselves. The emergency area can be a dangerous place because patients may arrive with infections, they may be bleeding uncontrollably, or they may have toxic materials on them. When we encounter patients, we should make sure to minimize hazard by being adequately prepared with protective equipment. There are 4 levels of personal protection: contact precautions, splash precautions, droplet precautions, and lastly, aerosol precautions. Contact precautions consists of hand hygiene, which is to protect the physician and the patient from infection by eliminating any contaminant that is on the physician's hands. It consists of hand washing for 40 to 60 seconds or rubbing gel on your hands for 20 to 30 seconds. The second part of contact precautions is putting on gloves. You should put on gloves before touching fluids or any wounds. They should be removed immediately after you have touched either the fluid or the wound, because otherwise your gloves become a carrier of infection or hazardous material. Remember that wearing gloves is not a substitution for proper hand hygiene. Splash precautions are used when there's the possibility of spray contamination. It consists of eye protection and gowns if possible, in addition to the gloves that we already mentioned. Droplet precautions protect us from most upper respiratory infections and should be worn when we are suspicious a patient has an upper respiratory infection. It consists of a mask that guards us from infections transmitted through large droplets, for example, Haemophilus influenza. Lastly, for infections that are transmitted through smaller droplets, we want to use aerosol precautions, which consists of a tight-fitting mask. This protects against agents such as tuberculosis. You must use a very well-fitted mask to protect yourself, and it's best if you mask the patient as well. If at all possible, you should isolate the patient. Let's think back to our multi-patient case. What kind of precautions might we need? For our 14-year-old boy, we want to protect our eyes and mouth and clothes from splashes since he is vomiting. Also, consider that the contaminant in the fertilizer might be an organophosphate, which is highly toxic. If you're exposed to it, you may come down with organophosphate poisoning as well. So, you want to fully protect yourself while caring for this patient, and so you should use splash and contact precautions. That means wear gloves, gown, eye protection, and a mask. Now let's consider the 4-year-old boy who is short of breath. We may be able to evaluate him better when he arrives, but if he's short of breath, you have to think it might be due to a respiratory infection, and we would want to have aerosol precautions at the very least so that we can be maximally cautious. Our farmer with the expanding thigh likely is bleeding into his thigh from a femur fracture. We can't be sure if this is an open fracture or not, but we should be prepared to handle blood by having on gloves and maybe even anticipating that this is a femoral artery bleed and maybe spurting blood, and so we should protect with a mask, gown, and eye protection. So splash and contact precautions are very important for this patient. With our very last patient, we should anticipate that there might be blood, although it's probably not an arterial bleed given that his hand is crushed. We should at least be cautious and wear gloves and use contact precautions. Some people may feel that it is selfish to take time to put on equipment when a patient is very sick and needs your help. Remember though, you have many patients to care for. If you get sick, they will all suffer. Some people might feel that the chance of transmission of a serious disease is so low that it is not worth the trouble to put on protective gear. However, healthcare providers have been identified as a high-risk population for the transmission of bloodborne pathogens such as HIV, hepatitis B, and C, especially when the prevalence of these diseases is high. So always remember to protect yourself. The other component of creating an optimal environment is creating a resuscitation room. What is a resuscitation room? It's an area that's designated for critically ill patients. You should have easy entry and exit to the resuscitation room from the front of the hospital because you want to be able to bring in your patient quickly to be able to see them when they are critically ill. And lastly, this area should be stocked with essential equipment and medication to handle emergencies. Why might you want to have such an area? Well, when speed matters, as it does in emergencies, organization and proximity of equipment and medications may save you the time you need to save your patient's life. Let's think about what we might want centrally located to take care of our critically ill patients. For a 14-year-old boy who might have an airway problem, we would want to consider that we should have intubation equipment close by. We would want to have the medications we need to do this intubation. We would want to have oxygen for pre-treatment. We might want to have a monitor available so that we can actually see where his pulse ox is at when we're intubating him. And lastly, we would want to have the supplies that we need in order to obtain venous access to give him these medicines. In actuality, you might need a lot of the same things for the second patient who is coming in with a breathing difficulty. Of course, we would need oxygen and we would need a monitor. But in addition to this, you want to think about essential life-saving medications that can quickly reverse emergencies. So that might include things like albuterol. If we consider that this patient might be short of breath because they're in anaphylaxis, we would want to have adrenaline close at hand. And that might be it for our breathing patient. For a patient that comes in with a circulation difficulty, of course we would want to have what we need to obtain venous access, both peripheral and central if needed. We would want to have the equipment to do cardiac monitoring, and we would also want to have pressors close at hand in case the person became hypotensive. And since we're concerned that this hypotension might be due to a bleed, we would want to have IV fluids readily available as well. For our fourth patient, we might consider that we would want to have immediate pain control on hand, particularly IV pain medication. And our last patient is our pregnant patient, who, quite frankly, should not really be taken care of in the resuscitation room. Essentially, if you want to summarize, in our resuscitation room, we would want the equipment and medication necessary for the stabilization of a patient's airway, breathing, and circulation. We would also want to have some medications on hand. These medications include the ones that we need to quickly reverse life-threatening and painful situations. Things like hypoglycemia, hyperkalemia, hypotension, and asthma, as well as the medications to intubate. As important as it is to think about what medications we do want in our resuscitation room, we also want to think about what it's important to not have in our resuscitation room. Unnecessary medications may be important in the minutes that follow the acute stabilization of a critically ill patient, but they are infrequently needed in most resuscitation situations. Thus, including them in our resuscitation room could lead to medical errors and confusions during a high-stress situation. It's better to have these medications conveniently available elsewhere in the ER. Let's review some of the equipment we decided we would want. For breathing and circulation, we would want oxygen, we would want suction equipment, monitoring, we would want oropharyngeal and nasopharyngeal airways, we would want nasal cannulas, bag valve masks, and we would want alternate airways like LMAs available if we had them. We would also want to have the equipment that we need to intubate, such as laryngoscope blades and the handle for laryngoscopes. We would want endotracheal tubes, and of course we would want vents close at hand. Remember that you should have these in both adult and pediatric sizes if you are seeing patients that are both adult and pediatric. If available, you would want end-tidal CO2 detectors as well. A word of caution. Part of creating an ideal environment is not only having a resuscitation room, but maintaining your resuscitation room. It's important to go through periodically and make sure your lights and batteries are working and your medication and equipment is replenished. Our resuscitation room must also contain the important supplies we need for venous access and also for monitoring of hemodynamic status. This includes monitors, blood pressure cuffs, IV fluids, and IV access equipment. Lastly, for trauma-related emergencies, we should have available C-collars, thoracostomy tubes, surgical trays, cricothyroidotomy trays, and backboards. Lastly, in our resuscitation room, we want to think about organizing our equipment so it is rapidly available and can easily be found by all. You can imagine with all of the equipment that we just went through, it would get very easy to become confused about where you put things. A crash cart with neatly labeled drawers is a good way to organize equipment. And in the case where we might be seeing pediatric patients, we might want to have a color-coded system so that all the equipment for a certain age group is quickly identifiable by a color type. It can also be helpful to post protocols and reminders up on the walls of the resuscitation room and have reminders of role designations when you're using a team-based approach. This allows for maximal efficiency and simultaneous interventions when there are multiple people caring for the patient. In summary, we want to create the best environment to help our patients by being prepared. We must always remember to wear personal protective equipment and to protect both ourselves and the patient. The resuscitation room is an ideal place for stabilizing critically ill patients. A resuscitation room should be easily accessible and have equipment that is used for airway, breathing, and circulation problems. And lastly, resuscitation rooms should be well organized and have visual protocols and reminders. It's important to practice and educate all staff on resuscitations so that you can create the most optimal environment for your patient. That concludes our lecture on personal protective equipment and resuscitation rooms.